Good morning and welcome to the West Virginia Pre-K Leadership System of Support webinar focusing on WVEIS and ELS data management and coding. This is the webinar that was originally done on November 9th, 2012, and we're just going to go through some of the highlights of this particular webinar. Some key points for today: we're going to talk a little bit about coding children and entering children's FTEs into WVEIS, provide some clarification about requirements for entering health data, entering attendance data, talk about some upcoming processes and initiatives, go through the STU 380 process for county pre-K coordinators, talk a little bit about child assessment system data, and then also talk about uses of the child accomplishment summary. To begin, though, we're going to go through some acronyms that some of you may be very familiar with, others may not. WVEIS is the West Virginia Education Information System. ELS is the Early Learning Scale and Assessment Tool, which is a component of the West Virginia Pre-K Child Assessment System. ELSF, of course, is the Early Learning Standards Framework. That's the state's pre-K content standards and objectives. And then an FTE is a full-time equivalent that is, of course, tied to school aid funding. So our first key point would be looking at clarification on requirements for coding and entering children's FTEs. As it stands now, we have two codes, CE versus CP codes, and one of the things that we want to make sure everyone understands is that CE and CP codes are based on collaboration services, not location. So the CP code is used when that child is enrolled in a program served only by the county public school system. And the CE code is used when the child is enrolled in a program that is collaborative with another agency such as Head Start or Child Care. So it is possible to have children sitting in a public school building who would be a CE code because that classroom is collaborative with Head Start or with Child Care. FTEs, of course, a full FTE is required for those children who receive more than 24 hours or more of instruction per week, regardless of the setting. And then, as you see at the bottom, the 0.5 FTE is the lowest, the minimum that can be offered as part of West Virginia Pre-K, and then there are lots of different areas in between. The clarification about requirements for health data into WVEIS, the data needs to come from health check documentation that's completed by the student's medical home. The data is entered by designated school personnel, not the classroom teacher, of course, and the designated school personnel should be determined through a county team approach. And in the past, the West Virginia Department of Education's Office of Healthy Schools, along with their RSWs, they've done trainings to support health data entry and access, and currently, as of March 2013, and even in February 2013, we've been working, the Offices of Early Learning and Information Systems have been working together to do some VPN off-site access to WVEIS so our off-site locations can enter health data as well. Another key point would be clarification about the requirements for entering attendance data into WVEIS. We have to have attendance captured for all West Virginia Universal Pre-K programs. Regardless of how that's done, we want to have protocol in place to make sure that all children's attendance data are captured. One of the big myths out there is that attendance data for pre-K will skew a school's attendance percentages, but we know from the Office of Information Systems that data collection in WVEIS includes the age of the student, IEP information, lots of other qualifiers. So this actually prevents these children from counting against a county's attendance rate. Upcoming processes and initiatives are some of the things that we covered in November when we originally did this webinar, and we know that we did have a SurveyMonkey survey go out to the county collaborative early childhood teams We had a lot of input from that, and we were able to determine which county teams were interested in pursuing off-site location access to WVEIS for entering health and attendance data. Those were some of the questions that were asked that you see on your screen right now. So we did work on, and we currently are working on VPN access as Richard Pullen and myself, Monica Delamay, meet with the county collaborative teams at the RESA level and other parties who are representing their counties, such as WVEIS coordinators, attendance directors, and then of course our collaborative partners with pre-K coordinators. As we are meeting with them, we're learning that there are several sites interested, and we're helping them pursue that as they would prefer. So now we're going to talk a little bit about STU 380 and the process for county pre-K coordinators. Many of you have seen this before. If you're a county pre-K coordinator, some of you live this often as part of the pre-K child assessment system. We know that a menu item has been created in WVEIS to help maintain and identify children properly in WVEIS to assist with completion of the West Virginia Pre-K Child Assessment System. So this is for children enrolled in West Virginia Universal Pre-K, children who are still 3 years old prior to September 1 of the school year, who are enrolled in 3-year-old standalone Head Start programs, and then children enrolled in Head Start home-based programs. It's important that the pre-K coordinators out there work with their special education directors and their county WVEIS coordinators to make sure all children are properly identified and tethered to the correct classroom or educator. So when does this initially take place? Typically, what happens first, well, not typically, but what does happen first is the county has to run promotion, what's called promotion, to move the county into fiscal year 13, typically around early July. Now we know coming up that it'll be fiscal year 14 in July 2013. County pre-K coordinators should check with their county WVEIS contact to see when this happens. After it happens, children may be entered into the fiscal year 13 year, and then STU 380 can be managed from there. So here are the procedures. WVEIS's STU 380 menu item provides information about the physical location of the child, the program time frame for each child, and then the child's teacher if they are in a public school building. If they're at an off-site location, then we know that that teacher isn't captured, but the site is captured. So if you're a county pre-K coordinator and you're new to this, you've not done it before, these steps will be really helpful for you. You would go to the address seen on your screen to log into WVEIS on the web. Log on with your WVEIS user ID and password, click Submit, select the Menus tab, and then you should have access to a menu item called STU 380 Collaborative Early Childhood Data. If you do not have access to that, please contact your county pre-K, or excuse me, your county WVEIS coordinator to give you access to this. Use the drop-down menu to select the district where you plan to enroll students. You'll typically use 0 for the regular district or R for related services. And then you use the drop-down menu to select the school in which you plan to enroll students. Now a screen will come up with the pre-K students enrolled at this school. Okay. Here's something really important. Check the boxes inside the names of, or beside the names of all the children who are enrolled in Head Start. If all the kids are enrolled in Head Start at the particular site, then you can select the top box and all the boxes will be auto-filled. But the really critical thing to remember about this is that children enter and exit Head Start services throughout the year. They become eligible and then they may not continue with Head Start, or they may decide, according to Head Start's waiting list, and if there is room and they have the space available for additional Head Start children as children exit and new children enter Head Start services, This has to be updated, this little box, for those children who are entering and exiting, and the reason why is because if it's not done properly, then the grantee, the Head Start grantee, won't be able to properly look at their outcome data for the pre-K child assessment system. So this is a very important point. Program type entry, you would indicate whether each child is enrolled in a half-day program or full-day program. Again, you can copy it, double-click to copy your previous response there with your mouse button for AM and PM or day. Now for location entry, if the child is within a school building, within school building is the defaulted selection, but if they attend pre-K at a site out of the school building, the directions come on this next screen. You'll click on the little icon that is beside of the words off-site location, and then the off-site locations menu will come up. Select the off-site location where each child is enrolled. Of course, you can double-click inside a location box to copy your previous response. If by chance the off-site location that you need to enroll that child at is not listed, let me know. It's mdellamea@access.k12.wv.us. My email is also provided at the end of this webinar, so you'll be able to write it down then. And then for those children who are within the school building, you'll want to select the teacher ID. Click on the teacher button, the button beside the word teacher to display a menu of teachers. Don't just assume that the teacher ID is the first 4 letters of the teacher's last name space first letter of the teacher's first name. That's typically the case, but sometimes teachers use their middle name instead of their first name, and you may not be aware. So use this menu tab right here that is beside the word teacher. That way what is officially on file as the teacher ID will be able to be selected from. Don't just make up your own. So you'll click once on the name of each teacher to populate the teacher field for each child. Again, you can double click inside a location box to copy your previous response. Now, after all fields are complete for all enrolled children, click Submit. And this is something also important to remember. In order to make sure that the pre-K child assessment system is running properly and updated correctly, then we ask that the county pre-K coordinators update enrollment at least monthly. We have some who do this as children switch classrooms as they enter or exit the program, but it needs to have some sort of protocol to ensure that it's done on a continuous basis. And we know that maintaining these accurate child enrollment, where children are at, is important in WVEIS for many reasons. The child assessment system, of course, includes, but is not limited to, children's health data, English language learner data, data from all domains of the Early Learning Standards Framework, the Early Learning Scale, and of course Office of Special Education program data. Here's some additional considerations that many of you have already seen before, of course, but are just very, very important. We want to make sure that class rosters are correct, and I know that many pre-K coordinators out there are sending out class rosters from STU 380 to their teachers before our checkpoint windows open for data reporting, and making sure that the class rosters are correct. If they're not, then the classroom teacher would need to let the county pre-K coordinator know, because that means that the child is not identified in STU 380 properly, or they're not in WVEIS, assigned to the correct grade perhaps. The other thing that could be a problem would be that the child has an unduplicated service in WVEIS as far as their special education tab. So who's responsible for this infrastructure? The county pre-K coordinators, where the responsibility ultimately lies, but it's something that we encourage them to work with special education directors, county or RESA WVEIS contacts, and collaborative partners as well. And we know that we have lots of types of data available, and different uses of data are going to be highlighted here now. So again, we have all this different information that is now available to us based on these different elements. We know that we had a lot of partners go into the development of this system. It's truly been a comprehensive approach that we've utilized in the development of the West Virginia Pre-K Child Assessment System, and our first partner, of course, being NEAR, what was the Office of School Readiness at the department, now the Office of Early Learning, Office of Information Systems, Special Programs, Healthy Schools, Title III, which is now federal programs, Head Start State Collaboration Office, DHHR, we've had RESA-based support, we've had county pre-K coordinators, special ed directors, WVEIS contacts, and then of course the pre-K advisory, CQI Advisory Council, School Readiness Work Group. So a lot of people have been involved and had their hands in the development of this comprehensive system. We have outcome reports available that show growth data at the state level, the Head Start grantee level, the county, the site, and the classroom levels as well. If you want access to any of these levels, contact me. There's my email. I want to show you an example of a state outcome report. This is the outcome report from the 2011-2012 school year, and you can see with the ELS we have our items and our strands, which are listed here, but under number 1, for example, number numerical operations, the composite is down here in yellow. This is time 1, which would have been in our October, our checkpoint in October. This is our February checkpoint, time 2, and then in May we had time 3. So with functional counting, for example, the average out of 5 was 2.44, and there were 16,064 children whose data were entered. During checkpoint 2, it went up to a 3.9, checkpoint 3, 3.79 was the average. So from checkpoint 1 to 2, the percentage gain was 30.56. 2 to 3, the percentage gain was 18.85, and then the overall gain from 1 to 3 for functional counting last year was 55.18% for that particular functional counting. The entire composite for number and numerical operations, of course, time 1, time 2, time 3 are highlighted. The percentage of growth from time 1 to time 2, time 2 to time 3, and then overall that shows tremendous growth, 64.83% for the year for West Virginia Universal Pre-K for number and numerical operations. So you can also look at each of the additional items here: classification and algebraic thinking, geometry and measurement, scientific inquiry, self-regulation, play, and then of course oral language, phonological awareness, print awareness, and writing. I do want to touch briefly on the uses of the Child Accomplishment Summary as well. This is the family form, the family reporting mechanism that we ask you share to articulate developmental progress to families, along with evidence that teachers have collected based on the formative assessment process. So we've asked teachers to make sure that they share the Child Accomplishment Summary during a face-to-face meeting or conference. They're not to be mailed out or sent home with the child only. That's because the Child Accomplishment Summary provides a snapshot, but needs explanation as well. Needs that teacher to go through and talk with the family about what this means and what's coming next, and some things they might try at home to help the child continue development along each domain. So the guidance for the Child Accomplishment Summary has actually changed since 11-12. We have a more streamlined approach now. Teachers don't have to save the Child Accomplishment Summary in Microsoft Word now. Instead, it's saved on the online reporting platform. So to complete a Child Accomplishment Summary for each child, I want to show you this to actually let you see what your teachers are doing. After they enter data for the ELS, they'll click on Data for Child Accomplishment Summary for each child. And then what we've done here is actually, with our alignment between the Early Learning Scale and the West Virginia Early Learning Standards Framework, we've identified the clusters of the Early Childhood, or of the Early Learning Standards Framework. And this is what will be populated into the child accomplishment summary. This language is much more family friendly. This language is positive, and it also provides a comprehensive view at how each child has demonstrated development or progress with in the different domains, such as social and emotional development, language and literacy development, math, and then of course further on down the screen would be science, the arts, and then physical and health development. So the teachers simply click the boxes that that particular child has shown progress with. When they finish the process, they click menu to exit after saving, of course, the data. And then to complete the child accomplishment summary, they click Child Accomplishment Summary. They use the drop-down menu to select the name of the child whose child accomplishment summary they want to complete. After selecting the child's name, they're going to scroll down to the bottom of the page. And if you look up here, you can actually see under, for example, physical health and development, we've developed some blanket statements about physical health and development and really about each domain in gray. And then underneath that are the clusters of the Early Learning Standards framework that the teacher clicked and indicated progress with. This is where the teacher gets to provide next steps or suggestions for families under each of the domains. Something very important to understand about this is that you can't copy and paste from one child's child accomplishment summary to another. It deals with coding, and the program itself does not support copying and pasting. Sometimes I get emails from teachers saying that I only have one small box now at the bottom of my child accomplishment summary, or everything's all jumbled. That's because they've copied and pasted. So that's not the intent, that any one child would have the same type of next steps. So you could make sure that they're not copying and pasting. That would alleviate a lot of problems. Click Print to view and or print the completed child accomplishment summary, and that's that for each child. I'll end by going through some frequently asked questions. This is a biggie. Do the child accomplishment summaries have to be done immediately after the data checkpoints? And the answer is no. It should be up to the County Collaborative Early Childhood team in conjunction with local schools to determine a schedule. The schedule does not need to match the times for data entry. Will the state be developing an assessment for physical development, health, and safety? The answer is yes. Actually, we already embed physical health, development, and safety into the pre-K child assessment system as an integral component of ongoing documentations. We know that teachers share progress on this domain to families already, but physical development as far as part of the ELS is coming from near, and we hope to have that in place and available training for teachers in the coming months. Who's responsible for inputting children into WVEIS? Typically the school secretary or other identified personnel at the school level is responsible for entering those children. Who's responsible for STU 380? Like I said, ultimately it's the county pre-K coordinator who's responsible for maintaining that. Who do we contact for technical support? For the pre-K child assessment system, contact me. Email is typically the best way, just because things are usually so specific, the types of questions that folks have, that I often do troubleshooting with folks in the Office of Information Systems, and they typically need a WVEIS ID or a teacher ID or some specific piece of information that is best shared through email. For technical support about ELS reliability, you can contact me, or you can contact support at myelsonline.com for help with that. Who's responsible for adding or deleting staff on the pre-K child assessment system reporting platform? The pre-K coordinators can actually manage that themselves, or you can email changes to me.